type of exercise you can do. It's a mindfulness activity that we do sometimes in social work. So what is mindfulness? I found a quotation, but simply it's being present. It's taking a moment to leave the chaos of what's around you. Focus on your breathing. Focus on where you are and how you can be in control of this moment. That's really the significance of it. Progressive muscle relaxation is just one of the many different forms of mindfulness, or one of many types of mindfulness activities you can do. So, primarily used to address somatic symptoms of anxiety such as muscle tension and pain. So, as you can imagine, if you're stressed all the time, a lot of times that cultivates in a lot of back pain. So this can also be taught to clients to utilize during a panic attack. It's less likely because it is kind of more involved. You'll probably do more deep breathing if you're having a panic attack, but if you're beginning to feel a panic attack come on, you can turn on a video and go through this process. So when you're implementing with clients, you'll begin with them by recalling and practicing deep breathing techniques. So this is something that you do over time. You don't sit down with your first client and you're like, today we're going to do this. It starts gradually. You teach them deep breathing. In through your nose, out through your mouth, just like yoga. So then you'll introduce rules for this new method that you're going to do, instruct them to know where they're feeling tension. That's how you'll start is, think about where you're feeling the most tension and focus on that part of your body. Then you'll complete your exercise and then you'll do an evaluation where they'll evaluate it. Ask them how that felt for them. Because there are so many different kind of mindfulness techniques. Some things work really well for some people and some don't. This one that we're going to do, I found works really well for me. There are other things like guided imagery where you close your eyes, you listen to a story, and you imagine you're on a beach. I can't do that. I can't imagine I'm on a beach. So you gotta evaluate how does this work for your client. So we're going to do a demonstration. Tiffany is currently seeing Max for anxiety. Together they have established the goal of Tiffany learning coping skills to manage her anxiety on her own. They have already practiced deep breathing in an earlier session. Tiffany is reporting muscle pain in her back, so Max suggests trying progressive muscle relaxation. So, if you guys would like to demonstrate, you want to turn the lights on?
I think it adjusted, so I'll be good.
We're good. So we can do this in an individual setting or do it in a group setting. So first I'd have the client grab a seat, make yourself comfortable. Some stuff you already went over. Progressive muscle relaxation is an exercise that relaxes your mind and body by progressively tensing and relaxing muscle groups throughout your entire body. You will tense each muscle group vigorously but without straining, and then suddenly release the tension and feel your muscles relax. You will tense each muscle for about 5 seconds. If you have any pain or discomfort on the targeted muscle groups, feel free to omit that step. Throughout this exercise, you may visualize the muscles tensing and a wave of relaxation flowing over them as you release that tension. It is important that you keep breathing throughout the exercise, so let's begin. So first things first, you always want somebody to be comfortable, feel comfortable. One of the things I always suggest to people is don't sit with your legs crossed or sit with your arms crossed unless that's just something that's really preferable. And feel free to try along. I've seen it better.
And we're also going to let you guys have an opportunity to kind of spread out through the hallways and do this with a partner on your own. We've got scripts for everyone, so
Okay.
don't worry.
All right, so begin by finding a comfortable position, either sitting or lying down in a location where you will not be interrupted, and allow your attention to focus only on your body. If you begin to notice your mind wandering, bring it back to the muscles that you are working on. Take a deep breath through your abdomen, hold for a few seconds, and then exhale slowly. Again, as you breathe, notice your stomach rising up and your lungs filling with air. As you exhale, imagine the tension of your body being released and flowing out of your body. Inhale and exhale. Feel your body relaxing. As you go through each step, I want you to remember to keep breathing. So now let's begin. I want you to tighten the muscles in your forehead by raising your eyebrows as high as you can. Hold for about 5 seconds, and then abruptly release them. Let all the tension fall away. Okay. Now I want you to smile widely, feeling your mouth and cheeks tense. Hold for about 5 seconds, and release. appreciating the softness of your face. Next, tighten your eye muscles, squinting your eyelids tightly shut. Hold for about 5 seconds. And then release. Gently pull your head backward as if you were looking at the ceiling. Hold for about 5 seconds. And release, feeling all the tension melt away. Now feel the weight of your relaxed head and neck sink. Breathe in and out. Breathe in and out. Let all the stress melt away. Breathe in and out. Now tightly, but without straining, clench your fist and hold this position until I say stop. You can release. Now flex your biceps. Feel the buildup of tension. You may even visualize that you're doing curls or muscle training. Hold for about 5 seconds. And then release your arms, enjoying the feeling of limpness. Breathe in and out. Now tighten your triceps by extending your arms and locking out your elbows. We'll hold that for about 5 seconds. And release. Now we're going to lift up our shoulders like we're going to put them on our ears. Hold that. And release. Now I want you to tense your upper back by pulling your shoulders back, trying to make your shoulder blades touch. We're going to hold that for about 5 seconds. And release. Now tighten your chest up by taking a deep breath in. Hold for about 5 seconds. And release. Now we're going to focus on the stomach. We're going to tighten up all the muscles in the stomach by sucking in. And release. Breath in and out. So now in the position that we're in, we're going to put an arch in our back, shoulders back, butt back. Really feel the tension in your low back there. We're going to hold and release. Breathe in and out. So now we're going to tighten up our glutes where we're sitting. We're going to squeeze our glutes together. And release. Breathe in and out. We're going to move down to the thighs. Same thing. We're going to tighten our thighs up, our quads, our hamstrings. Tighten them up. Breathe in and out. Now flex your feet, pulling your toes toward you and feeling the tension in your calves. We're going to hold that. And release. Now we're gonna curl our toes under our feet, tensen up. And release. Breathe in. And out. In. And out. Now imagine a wave of relaxation slowly spreading through your body, beginning at your head and going all the way to your feet. Feel the weight of your body relax in your seat. Breathe in and out.
Okay.
One last deep breath in and out.
Okay, good job, everybody. I hope you feel a little more relaxed than you did when we started. And I think our time is up, right? So we're good? We're good. Great job. Thank you, guys.
Questions?
Questions?
Can we ask them a question first? Or is that allowed?
Sure.
It's all allowed. There's no.
I didn't know.
Yeah, go ahead.
Okay. How do you go? What do you guys think about the exercise in general? Like, how do you feel about it?
I feel like it could be too long. Is there like a short form? So if you're in a public space and you have a panic attack coming on, I feel like it's
So-
really hard to stop what you're doing.
So the panic attack example, so like in the capacities that I've used progressive muscle relaxation before, we talk about it as like a self-control strategy. We mentioned like mindfulness here. So as far as like in a panic attack episode, it's probably not the chief thing you should go to in trying to combat that. Like Audrey mentioned, you probably want to go to more just focusing on the breath at that point. This is kind of like the next level up of, like,
Your prevention maybe of it.
yeah.
Okay.
And the way like we use it with guys in like the incarcerated setting or in the treatment setting is like something that they do or allot time for regularly to try to like be in a more relaxed state and be more mindful of where they're at and what they're doing and those kind of things.
Also, if you have done it before and you are having a situation like that, you can, just when you're by yourself standing, just like clench your own muscles and take a deep breath. Like, you don't have to go through the whole thing with your whole body, but it's still just a way of being in control of, like, I'm feeling tension here, I can tense these muscles and breathe that tension out. So you don't have to do the whole thing.
And also, like, with my clients, I like to use, of course, like not when they're in the middle of a severe panic attack, but once I'm able to, slow the breathing down, I have them do a technique called grounding. And I ask them to look around the room, take in every item in the room, close their eyes, and try to tell me those items back. And it kind of gets the mind distracted because the brain cannot focus on like two things at once. It can't focus on the anxiety and, the goal that I'm asking the client to complete. So that's a good technique we use too.
Any other questions? Yeah.
So, first I was gonna say that I have really bad insomnia, and that I was taught this technique is a way to like relax before trying to go to sleep. But I was wondering, I noticed that you did like a top-down approach. I was wondering if that's like the typical, or is there any like standard, like go this way, use this muscle first?
I thought it was ironic too because in the ones that I've used it was the bottom up.
Oh, really?
And the ones that
I've
I've
never done
seen.
it.
But I'm sure that I don't know if there's any research on what the rule of thumb would be, like what's more effective. Like, I felt so much more relaxed when I started at my feet. I don't know if that research is out there or if, I don't know. But,
Yes.
Is this something you can do with children? And if so, do you have to make any modifications to do this with children?
I have never done this with children before. I'm sure this would be a fine technique. I haven't read anywhere that it wouldn't be. You'd probably use different words and I don't know, just working with kids in general, you have to be a little more personal and you yourself have to be a little more vulnerable, so you have to get in there and be willing to, do you feel it in your tummy? Breathe out, good job. I don't know. Have you guys ever done this with children?
I've worked in the juvenile center with juvenile delinquents.
Mhm.
So I really haven't been able to work with children with problem behaviors. So, I mean, not problem behaviors, but, you know, anxiety disorders and stuff like that. It was mainly, you know, problematic episodes and things like that. So I've really never had to work with children as far as that goes yet.
Well, I don't have any experience working with kids outside of parenting, which is a whole nother animal.
Right.
But I would be interested to see like a group of 5-year-olds try it. Like,
Me
see,
too.
especially if it was like in a, I don't know setting. I don't know if you could get them to sit down and do it, but I would feel like if you could do the lay down, where you're laying down on a mat in a quiet place, like I feel like they might be able to get into that because it's like, oh, they just told me to get on the floor, and my dad always tells me to get off the floor when I'm in places, you know, because I crawl around Kroger's on my knees.
I can say something about that. 'Cause
Yeah.
my mom specializes in working with children who have behavioral problems, and she actually goes to schools with kids who have at-risk behaviors and works with them there. And she has a lot of mindfulness books, and they have like some workbooks and stuff that she's been able to do with, like, you know, middle schoolers. But when it comes to like elementary schools, she has a bunch of different kinds of like tactile like stress balls, and she'll have them use the pressure there because then they can feel it in a different way, and it's not as constricting as their
Brilliant.
body. So she'll have a different item, and then they still are using that tension, but they have something else that they're familiar with.
That's really cool. I'm happy to
Interesting,
know
yeah.
that.
Thank you.
Absolutely.
I'll just say that I honestly did not know that social workers did this. We do it in nursing as well, mainly with patients with pain and insomnia and relaxation techniques. But I did